Good morning. I am Amanda, the pharmacist. Can I help you?
Do you have medicine for fever?
For what age?
2.5 years old child.
Do you want it syrup, chewable tablet, or drops?
What are the differences?
They contain the same medicine. It's just a matter of which one the child prefers.
What about divided powder? My child gets divided powder frequently from the doctor.
We usually make it based on doctor's prescriptions because the dose of the finished products needs adjustment or because we need to combine it with other medicine. And what do your child feel?
Only fever since this morning.
Any cough, sneeze, or diarrhea?
No.
Any allergies to certain drugs?
No.
Okay, just a moment. I'll get you some alternatives.
Pharmaceutical preparations have various dosage forms and purposes. In general, a dosage form is a combination of drug substances and excipients to facilitate dosing, administration, and delivery of the medicine to the patient. The pharmacist must be able to help patients choose the most suitable forms to their conditions. Pharmaceutical dosage forms consist of, but not limited to, solid preparations. Powders are intimate mixtures of dry, finely divided drugs and/or chemicals that may be intended for internal or external use. Because of their greater specific surface area, powders disperse and dissolve more readily than compacted dosage forms. Children and those adults who experience difficulty in swallowing tablets or capsules may find powders more acceptable. Drugs that are too bulky to be formed into tablets or capsules of convenient size may be administered as powders. Oral powders may be dispensed in doses pre-measured by the pharmacist, that is, divided powders, or in bulk powders. Dusting powders are impalpable powders intended for topical application. They may be dispensed in a sifted top container to facilitate dusting onto the skin. Capsules are solid dosage forms in which the drug is enclosed with either a hard or soft-soluble container or shell. Capsules are intended to mask unpleasant tastes or odors of powders or liquids. Capsules may be enteric-coated, called as delayed-release capsules, to resist releasing the drug in the gastric fluid of the stomach where there is drug inactivation or gastric mucosal irritation. Extended-release capsules are formulated in such manner as to make the contained medicament available over an extended period of time following ingestion. Tablets are solid dosage forms which is compressed or molded. A tablet is practical in use and have many forms. A conventional tablet can disintegrate in a limited time. Buccal or sublingual tablets can be absorbed directly through oral mucus. Effervescent tablets are soluble and release carbon dioxide when dissolved in water. Chewable tablets produce a pleasant taste and easily swallowed, suitable for children. Lozenges are intended to dissolve or disintegrate slowly in the mouth, intended for treatment of local irritation or infections of the mouth or throat. There are also plain coated tablets, which are coated with sugar or film for purposes of identification and aesthetic value. Delayed-release tablets, which are enteric-coated, to delay the release of the medication until the tablet has passed through the stomach, and extended-release tablets, which are formulated in such manner as to make the contained medicament available over an extended period of time following ingestion. Semi-solid preparations. Examples of semi-solid preparations are suppositories, pastes, ointments, creams, and gels. Suppositories are solid bodies of various weights and shapes, administered into the rectal, vaginal, or urethral orifice, which melt and dissolve at body temperature. A suppository is used for a faster systemic or local action. Ointments are semi-solid preparations intended for external application to the skin or mucous membranes. They serve to keep medicaments in prolonged contact with the skin. Paste are semi-solid dosage forms that contain one or more drug substances intended for topical application. Paste consists of thick, stiff ointments that do not ordinarily flow at body temperature and therefore serve as protective coatings over the areas to which they are applied. Creams are semi-solid dosage forms containing one or more drug substances dissolved or dispersed in a suitable base. Creams possess a relatively fluid consistency, formulated as either water in oil or oil in water emulsions. Gels or jellies are semi-solid systems consisting of either suspensions made up of small inorganic particles or large organic molecules interpenetrated by a liquid. Gels can be used to administer drugs topically or into body cavities. Liquid preparations. Examples of liquid preparations are solutions, suspensions, emulsions, and extract. Solutions are liquid preparations that contain one or more chemical substances dissolved or molecularly dispersed in a suitable solvent, so they provide for the assurance of uniform dosage upon administration. Oral solutions or oral suspensions containing high concentration of sugars are called syrups. Oral solutions that contain alcohol as a co-solvent are designated as elixirs. Otic solutions are solutions prepared with solvent and dispersing agents intended for instillation in the outer ear. Ophthalmic solutions are sterile solutions essentially free from foreign particles, suitably compounded and packaged for instillation into the eye. Suspensions are liquid preparations that consist of solid particles dispersed throughout a liquid phase in which the particles are not soluble. Some suspensions are prepared in sterile form and are used as injectables as well as for ophthalmic and otics administration. These may be of two types, ready to use or intended for constitution, with a prescribed amount of water for injection or other suitable diluent before use by the designated route. Suspensions should not be injected intravenously or intrathecally. Emulsions are two-phase systems in which one liquid is dispersed throughout another liquid in the form of small droplets. Where oil is the dispersed phase and an aqueous solution is the continuous phase, the system is designated as an oil in water emulsions. Conversely, where water or an aqueous solution is the dispersed phase and oil or oleaginous material is the continuous phase, the system is designated as water in oil emulsion. Extracts are concentrated preparations of vegetable or animal drugs obtained by removal of the active constituents of the respective drug with suitable menstrua. They can be in a form powders or fluid extracts. In addition to the pharmaceutical dosage forms already mentioned, there are also other dosage forms such as aerosols, inhalations, injections, and so on. The selection of dosage form is based on several considerations. It could be due to the condition of the patient, such as unconscious, which makes it impossible to administer the drug orally. The disease, such as skin infection, which need a prolonged contact with the skin. The active substances, such as the compatibility with the base or solvent, or even cost considerations among other considerations. Pharmacists must know and understand various pharmaceutical dosage forms so they can recommend the best medication for the patient.
Okay, here they are. This is paracetamol chewable tablet. It costs about 15,000 rupees. This is a paracetamol syrup, costs about 12,000 rupees. And this is paracetamol drops, costs about 19,000 rupees. We also have a paracetamol suppository for rectal use if the temperature is very high. But you should take your child to the doctor as soon as possible.
Which one should I take?
Have you measured the body temperature?
Yes, around 37-38 degrees Celsius.
Oh, well, if your child is not fussy in taking medicine, I would recommend the syrup because it's usually the safest for children and not too costly.
Okay, I'll take this one.
Alright then, I will explain the direction for use. For 2.5 years old child, please take 1 spoon 3 times a day as long as feel fever.